All right, everyone, welcome back to another episode of ICU. Today, we are going to talk about all things Kegels. And to help me do that, I have Darla Cathcart with me. She is a pelvic floor physical therapist with 20 years of experience. So, welcome to the show, Darla.
Hi, thanks, Kelly, for having me. I'm excited to be here.
Yes, I'm so excited. And I forgot to ask you, where are you located?
So I currently live in Conway, Arkansas, which is central Arkansas, close to Little Rock. I grew up in Louisiana. So Louisiana is kind of my stomping grounds, but I was born in Michigan.
Oh, wow, you've been all
Yeah,
over.
yeah. So I have a weird, convoluted story of all the places I've lived, but currently I live in Arkansas.
Nice.
Yeah,
Awesome.
yeah.
So, can you give the listeners a little background on you and how you got into the world of pelvic floor physical therapy?
Yeah, absolutely. So I went to PT school in the year 2000, and going into school, I heard about pelvic PT, and at that point, it was a really young profession in our country. This profession started in the 70s in our country, and so going into school, I heard about it, and it was just this like I just knew that that's what I was going to do. So I was the weird girl in school that every project I somehow made it about women's health and pelvic health, like neuro project, like, oh, MS and bladder issues. So all through school, that was me. I got my first job in an outpatient ortho clinic, and everybody knew that I wanted to do pelvic health, and I was trying to go to courses and get educated. And so then they started giving me all the pregnant patients. And so then it just kind of blossomed from there. So that's really kind of how I got into pelvic health. My sister had endometriosis and pelvic pain issues. My mom has had bladder issues. She has actually been recently diagnosed with IC. So I've been just kind of, I've watched their journeys with some different pelvic conditions. And so I think that was just sort of part of my calling. And then a few years ago, I had the opportunity to get a PhD, and in doing my dissertation research, I've really focused on my research project focused on working with patients with lifelong vaginismus. So, pain with intercourse essentially, and using vaginal trainers or dilators for addressing that.
Yeah. It
Yeah.
sounds like you have always known that you wanted to get into this. So, that's amazing.
Yeah, it's kind of wild. I when I was cleaning out a closet, after I'd gotten into PT school, or a few years after I'd gotten into to doing physical therapy, and I found this paper that I had written in college that was about painful periods, and it was like it was an English technical writing paper. So I was already just focused, like that was just always my calling, was like, how can we help people with vaginas and uteruses? How can we help them have a better life?
Mhm.
Yeah.
Absolutely.
Yes.
So, when you and I were chatting initially about what we wanted to talk about on this episode, you were like, let's talk about Kegels.
Ah,
And
yeah.
I was really excited that you brought that up because that is a hot topic in the interstitial cystitis community. And we always kind of, I say we as a community, but we kind of look at that as a red flag if somebody is going to pelvic floor physical therapy with IC and some a therapist tells them to do Kegels, everyone on like support groups will be like, oh, that's a red flag, you need to go to someone else, they don't know what they're doing. And so it's great that you want to talk about this. So let's first
Yeah.
have you define what a Kegel is for everyone.
Yeah, absolutely. And I think this is such an important topic because it can be nuanced. So it's so great to hear from you that, in your communities, you guys are like, hey guys, this is, red flag for something that may not be the best in therapy. And I think it's so good to be able to have those conversations, but then also to realize that something prescribed appropriately may actually be helpful. So what a Kegel is, so a lot of your listeners probably have some familiarity with the term and its history, but Dr. Kegel, Arnold Kegel in the 1940s. So he developed this exercise focused at women after they had had babies, for strengthening the pelvic floor. And what he had was this little thing called a periometer that looks kind of like a big tampon that was inserted vaginally, and the patient was asked to squeeze around that. And what he found was people that could squeeze at 20 millimeters of mercury or more, so like a blood pressure cuff reading, that those folks tended to have less leakage. So he would have them do these exercises to prevent urine leakage. So to contract the muscles, if you have a vagina, then you can squeeze the muscles around the vagina up and in. So same thing for the anus. So you can kind of imagine that you're kind of pulling the anus up into the body. You can imagine you're using your labia to pick up a marble off the chair, or that you're squeezing around a tampon or holding in gas without clenching your butt cheeks. And then the opposite motion, because this can also be a part of pelvic floor muscle training, is to bear down. So this is where you would actually relax the pelvic floor muscles completely and gently push out as if you're pushing the anus away from the body or pushing a tampon out of your vagina. It should feel like you get a little bulge of your labia outward. So that would be a bearing down motion.
Yeah, it's so interesting because my most recent pelvic floor physical therapist, she had this machine
Uh-huh.
that she kind of hooked me up to and was looking
Biofeedback.
at, what is it called?
Biofeedback.
Biofeedback, yeah.
Uh-huh.
And she basically was looking to see, I guess, the muscle contractions, and she would have me bear down and
Mhm.
get the data that, I don't know, was coming out of this biofeedback machine.
Yeah.
And she determined that bearing down was something that I needed to practice outside of my
Mhm.
sessions with her.
Mhm.
And she actually told me also that Kegels like wouldn't really be harmful for me, but she didn't really think I needed to do them. So
Right.
it was a
Yeah.
really interesting
Yeah.
experience.
Yeah. Because a lot of folks with IC don't need them, but we'll get into that.
Yes.
Yes.
Yes. So when it comes to Kegels, I mean, who are they appropriate for and who are they not appropriate for?
Yeah, absolutely. So, that really gets into an assessment of the muscles themselves. So, if you're coming to see me as a patient in therapy, then I'm going to do an examination of your muscles. So, typically that's done, and you've had other pelvic PTs come on that kind of talk about, we typically will insert one glove lubricated finger vaginally, and then we'll assess a couple of things. So, one thing that we're looking at is the tone. So if you just touch your bicep while it's relaxed and feel what it feels like, if it's a good healthy muscle, then it should feel kind of spongy like sponge cake. So that's the first thing we're looking at is what is that tone like? And if it's unhealthy, it's either sort of weak and flaccid, which most folks with IC don't have a weak flaccid muscle. Usually you have the opposite where the muscle's kind of tense and tight. And that's when I say that the muscle tone feels like a hard brownie. So you go in and you feel it and you're like, oh, there's like a little hard brownie in there. So folks who have a hard brownie, we don't want to just be giving them strengthening Kegels per se, but we may give you some gentle contract, relax breathing exercises that are a little more nuanced for helping to elicit some relaxation, like with using vaginal trainers, things like that. So I would say first, it depends on the muscle tone. So if you have too much tone, just doing Kegels for strengthening is not appropriate. If you have normal tone or good tone, or if you have less than normal tone, then those folks doing, some different gradations of exercise could potentially be helpful for, controlling a bladder urge or for doing some of the bladder training, for kind of working on spacing out. And so it really needs to be very individualized to the person,
Mhm.
and based on what's going on with them.
Okay, got it. And are Kegels different from pelvic floor muscle training?
So you'll hear those two terms kind of used interchangeably. So when you think about, and this is where a lot of pelvic PTs are really like, let's get away from the term Kegels, because it is a very confusing term because you hear Kegel and you think, okay, I'm going to hold my breath and I'm going to squeeze and raise my eyebrows, right? And squeeze as hard as I can. And that's really not good for most people, right? So fast forward, 80 years, and we now have this whole profession of pelvic health PTs who've kind of taken this exercise and said, how can I nuance it for the patient in front of me, right? And so, if you're coming in, so I have a patient right now who has IC. She's older, she's in her 80s, and she has actually good normal tone of her muscles, but she has some tenderness. And so for her, I really nuance doing some very gentle pelvic floor muscle contractions. And she finds that those help her with being able to control urgency and not have leakage when she's needing to get to the restroom. So it can be, but it is very gentle, right? And so I talk to patients about, your pelvic floor muscle. We might think of it being on a dimmer switch. So sometimes I need just a gentle light squeeze because I'm trying to inhibit the bladder. Sometimes I need a hard squeeze because I'm about to cough or sneeze, right? And so we can kind of nuance the amount of contraction based on what you need that contraction for. And so for my patients, if they tell me, I have lots of, leakage on the way to the bathroom versus with a cough, I'm going to nuance how they're training that muscle so that they can functionally use it the way that they want to. Does that make
Mhm.
sense?
Yeah. Yeah, totally.
Yeah.
Random question, but
Yeah.
is there a statistic out there that talks about the percentage of people diagnosed with IC that also have pelvic floor dysfunction?
Yeah. It's about 75%.
That is a
Yeah.
lot. I'm
It's a
not
lot,
surprised by
right?
that, but, like,
Yeah.
that
Uh-huh.
we need to further research that and come up with
Yes.
something because, do you feel like a lot of people and I was kinda talking to Dr. Janelle about this in a
Yeah.
previous episode, but interstitial cystitis being that, like, umbrella diagnosis
Mhm.
where, you can't really figure out what is the cause of those
Yep.
symptoms. Do you feel like pelvic floor dysfunction is the main cause for a lot of people with IC?
Yeah, I think that there are folks who, and if you really look into some of the IC research itself, and I'm sure you've probably read a lot of this, there's the IC where they can go in with a scope and actually see, inflammation or ulcerations or actual changes in the bladder. If they were to take out a little biopsy of that bladder wall, it looks different from what you would expect the bladder to look like. And then there are folks with this sort of like, you have this IC diagnosis, but they check your bladder out and they say, actually, your bladder
Yep,
looks fine and normal, and there's nothing wrong with you, which is the
yep,
worst
that was
thing,
me.
which is the worst thing that patients can hear. It's so frustrating, right? Because then you think, am I crazy? Am I
Yeah.
being medically gaslit here? What's happening? And
Mhm.
so I think for those people that those folks that it's more of pelvic floor muscle dysfunction, maybe kind of a heightened sensitivity, of their nervous system and their pelvic floor. Maybe there's some hormonal inputs, there can be different things, but I think for a lot of those folks, the pelvic floor is probably a big piece of that puzzle. And I think it's probably not one thing. I think it's probably multiple things adding up. And that's what makes it hard to diagnose and figure out what
Definitely.
the problem is. Yeah.
Yeah, and personally, like, I do a pelvic floor dysfunction, and I know I've had it for probably the majority of my life, and I find that stress only makes it worse, and
Yep.
those are two, completely separate things, but they feed into one another, and when I'm stressed, I clench my pelvic floor, and I hear
Yep.
this from so many IC
Yes.
warriors. I
Yep.
mean, I
Mhm.
think a lot of us are doing that. We're just kind of going
Squeezing.
through life, squeezing our pelvic floors, and we don't
Yeah.
even realize it, and
Huh?
for me, it's like when I'm in a situation where I could right now be recording with you and I'm clenching my pelvic floor, like, when I realize I'm doing it, it's already too late, and that can be super
You're like,
frustrating, like, the flare is
yeah, or you're like,
already
mhm.
yeah.
Where you're like, how do I get it to release? And so that's where I'll work with patients as far as, one of the things, as you know, is getting some manual therapy to help get that tone normalized again, right? So that can be the therapist doing some of that intravaginal, or if you don't have a vagina, some intrarectal work on that muscle. It can be you using your vaginal trainers or dilators or using your pelvic wand. Um, but those things can kind of help normalize the tone. The other thing that happens is just some awareness. And so, one of the things that I really talk with patients about is sort of this prophylactic, like check ins with your pelvic floor. So, early on, I'm going to have patients. Here's what I want you to do: is I want you to set a little gentle reminder on your phone. You don't want it to be like something that makes you squeeze. It needs to be a gentle little ding, but just setting a little reminder or having a little sticky note at your computer, something that is okay, what is my pelvic floor doing right now? So that you can start picking up on it before you get to that space of like, oh shoot, I've been squeezing really hard because I'm really focused or stressed or on the phone with this person or whatever it is that is your trigger for pelvic floor squeezing, kind of starting to identify at the beginning stages of my pelvic floor muscles are squeezing just because I'm sitting here drinking my coffee, for
Mhm.
instance. Yeah,
Yeah.
yeah.
It's kind of like having a cup that gets to a point where it overflows, and that's where the flare comes from. And if you check in at various points throughout the day, you could probably prevent that cup from overflowing.
Yeah, yeah.
I, I feel like that cup analogy just works in so many different scenarios. I was just talking about it last week
Yes.
with a dietitian on this show, and it just applies to so many different things.
Yeah, yeah, because it is those sort of additive things, right? Like you're identifying that it's the stress and it's the repetition of and the ongoing, it's the squeezing all day that becomes the problem. So it's not doing a little squeeze here and there, it's that I clench my pelvic floor all day long. So
Mhm.
I talk with patients about how, a lot of the folks that I see that have pelvic floor muscle dysfunction where they tend to contract all the time. I talk with them about, how some people maybe they scowl when they're stressed or they tense through their shoulders. So maybe they get tension headaches. And folks with pelvic floor muscle dysfunction, maybe they do that too. But oftentimes their main thing is the pelvic floor. And I think it's because these are folks who, for maybe it's their job, maybe it's their personality, maybe the way they were raised, but your job is to kind of, keep the peace, stay cool, have a cool facade, and don't let folks see that you're stressed or upset, right? So I see this a lot with, patients who are managers, for instance. So when that person knocks on my door at 3 p.m. and says, "Hey, can I talk to you?" As a manager, you can't be like, this is not a good time, right? Like you have to be like, yeah, sure. And so the safe place to hold tension is now your pelvic floor. So now your pelvic floor almost becomes like a stress ball
Mhm.
that you're just squeezing. So kind of getting that awareness of starting to figure out what are my triggers so that I can stop it right at the outset of like that person just walked in the door. Okay, what's my pelvic floor doing? Okay, can I let it go? Can I take a deep cleansing breath? Maybe I now have a stress ball on my desk that I squeeze instead, or so finding some other outlet to move that stress through the body. There's a really great book. I don't know if you've seen it. I don't think you and I talked about this yet, but Emily Nagoski, she has a book. She and her sister, I can't think of her sister's name, but they have a book called Burnout,
I
and
have
it's
not
about
heard of it.
Oh, yeah, I think you would love it. It's about breaking the stress cycle. It's about dealing with the stress cycle, and it's geared to cisgender females, so it's geared towards women. So
Um,
burnout.
okay, I'm currently on Amazon
Like I'm
buying
looking
it.
it up right
It's
now.
only $8.
Yeah,
What a
girl,
bargain.
get it. Yeah, you're like fast
I'll
track that.
link this in the show notes too. Like, I swear, we're gonna sell them out. You're welcome,
Oh yeah,
Emily.
oh yeah.
It's so funny. I posted a video on TikTok a couple weeks ago about the fire crotch balm that I use. It has peppermint
Yes,
in it. It's
yes,
the best thing ever. And
yes.
it sold out within a few hours of me posting
That
that.
is
I was like, oh no. And then
awesome.
there's
I love
only
it.
one person who makes it. And I'm like messaging her, like, can you please make some more? Or like tell us how to make it ourselves.
I love it. That is so great. I know you were talking about on the episode. I was like, that sounds really like amazing stuff.
Oh, it's
Yeah.
the best. It really is. And so many of my clients use it, and it's just really great if you're someone who likes that cooling sensation. It's
Yeah.
it's so interesting because about half of people with IC like the cool and other people like heat. And to me,
Yep.
it's like I would never use heat,
You're
but other people
crazy.
love it.
Yeah. Yeah. So what I tell folks is, if you're in a really acute flare and there's inflammation, cold is the better option, even if you don't love it. So even if you have to alternate, like do some heat, then do some cold. Cold is going to reduce inflammation and it's also going to calm down muscle spasm. Heat tends to feel better more for that. You're not inflamed, just your muscles are just kind of angry and tense. So both can be good. I tell folks like figure out what works for your body, and sometimes it's both, depending on the situation.
Yeah, that goes for a lot of things with IC. It's like you need to figure out what works for you. You have to find the
Yep.
solution to your unique puzzle. I say this every day. I feel like a broken record, but that's really what it is. We're just such a diverse population. Like whatever works for one person might not work for the next. And so you need to find
Uh-huh.
things that work for you, and it's probably going to be different from other people.
Exactly. Yeah. And that's one thing that I've really loved in listening to your podcast is just that very pragmatic approach of, there's not a blanket answer for everyone. It's a what's going to work for the person in front of me. And what are the things that are their specific triggers? And I talk to patients too about, sometimes your triggers are dose specific, right? So maybe a little bit of stress and a cup of coffee aren't a problem, but maybe a lot of stress or 2 cups of coffee is a problem, right? And so
100%. Yep.
figuring out
I
that dosing for yourself and being able to, make decisions around that, I think is really valuable.
Yeah, absolutely. And that's where identifying your triggers is so important because if you know that you can only have 1 cup of coffee when you're feeling a lot of stress,
Mhm.
it's like, that's great. It's empowering you to
Yeah,
still have that, still enjoy your coffee, but also not poke the bear
exactly.
and cause a flare up.
Tiptoe around the bear. Tiptoe around the bear.
Right.
Yeah.
Absolutely. And, if you have to take pre-leave that day, then so be it. That's
Mhm.
just like learning your limits can improve your confidence and that improves your overall quality of life.
Absolutely. And doing the things too that maybe I have coffee, but maybe I water sandwich it, right? Like in my water before and after. So I have my water bread and my coffee is the meat. So
I
figuring
like that. I've never heard anyone say that before.
Yeah. So
That's great.
I encourage patients to aim for, I'm like, figure out what works for you. But in the beginning, kind of a good guideline for a lot of folks is a 2/3 approach. So for every 1 cup of irritant, you want 2 cups of water to flush that out and dilute. So that can be a good guideline as a starting point for a lot of folks.
That's an interesting thing because and of course, I wasn't planning on asking you this, but a lot of people with IC will restrict their fluid intake because they think it's gonna help with frequency and urgency. Can you explain why that may not be the case?
Absolutely. Yes. So we actually even have a TikTok. I feel very old when I say that I have a
You have a
TikTok.
TikTok?
Yeah, our
What?
clinic has a TikTok. Yeah, so we actually did a little TikTok demo on this. We are definitely not viral at this point, but my gal Sarah is working on it. She's working on it. But so I did a little demo where so imagine a kitchen sink that's full of water. So you have this like fresh water that you're ready to wash the dishes. And let's say that you're putting your dishes in and you have a cup that has just like a little bit of Dr. Pepper, a little bit of coffee that gets accidentally dumped in the sink. That little bit of a couple of ounces of, let's call it dirty, for lack of a better word, dirty water going into the clean water, you're probably not going to empty the whole sink out, right? Like that's probably, you have enough water to dilute what's going into that sink. So now let's take that same sink of water. Now let's dump in a 2-liter soda. Now, what are you going to do now with that sink? Are you going to wash dishes in that sink? Probably not. You're probably going to have to empty it out and put fresh water in. And so when you think about, water is really going to dilute what's going into your bladder. So, if I worked with a urogynecologist who said, anything that would splash into your eyes, so the inner side of your eyelid is a mucous membrane. He said anything that would splash into your eyes and potentially cause burning. He said, I want you to think of it having that same effect on the inside of your bladder, potentially, if your bladder is sensitive, that it's that same mucous membrane. He said, but if you really, so he said, then if you go to a wash station and wash it out, you're good usually, right? And so if you think of whatever I put into my body that could be potentially irritating, if I bring in more water, that can now dilute that out.
Mhm. Is it similar to, like, if you had a cut in your finger and you poured, something on it and it burned?
Absolutely. Yes. Yeah.
Happens
So
to
that
me a
water
lot.
just,
I'm a
yeah.
finger picker, and I'm not proud of it, but it is something that I'm doing it right now. I need to sit on my hands.
It's so that takes me back to that burnout book, because that is your way of sort of moving the stress through your body, right? Like it's like a fidget spinner for you. It's like a built-in fidget spinner, right?
Yes, it is. It really is. I've never found anything that I can like actually not enjoy, but like something that is the same, like feels the same for me in terms of like that outlet, and fidget spinners and things like that just don't do it for me.
Not the thing. Yeah, I have a friend who's a pin clicker. Like she'll click a pin. She's like, but I can't do it everywhere,
Probably
right?
so annoying for everyone.
Well, and but she's also very conscious of the humans around her. She's like, I can do it in a room by myself, but I can't do it if I'm out in, a coffee shop. I can't just be sitting there clicking my pen. But so
Yeah.
hers is also foot tapping, tapping
I've
the
always been the person
foot
that
tapper.
shakes my leg up and down
Yep.
and
Like the whole
taps my
table is
foot.
shaking. Yeah.
Yeah.
I resonate with that real hard. I'm the same way.
Our bodies are just so interesting.
They really are fascinating. They really are. Yeah. So
Yeah.
in the burnout book, the author talks about, she says, she said, life is full of stress and we can't get rid of stress. So when folks talk about managing stress, it makes you feel like, okay, am I putting a bear in a cage? Like, what am I doing with this stress? But she talks about doing things to move stress through the body. So she talks a lot about, your fight, flight, or freeze. And she said, well, what happens to a lot of folks is instead of fight or flight, which helps move the cortisol through the body, what a lot of folks do is we end up freezing. So we squeeze the pelvic floor, we tense the jaw, and now you have all that stress that just like sits in the body and gets all of your systems, your hormones, your inflammation, just all riled up. And so she talks about starting to find ways to move that stress through the body. So that's what you do with picking your finger, right? Or twirling the hair or tapping the foot. Like that's a way of like, okay, I'm moving this stress through the body. So she talks about, things like, so she gives examples like, some people may benefit from a primal screaming session that you just go out in the woods and scream at the top of your lungs. She said, or it might be going to, karaoke night or having a karaoke machine in your house like that. She says it should be sort of physical, or noisy. So you're singing, you're screaming, you're laughing. So laughing, like going to a movie and lots of laughter. So that can move the stress through the body. Exercise. So, going for a run, going to the gym, whatever it is that works for you. I have a friend who, she every now and then will post on Facebook, like, well, I just went to the woods and threw a bunch of plates at a tree. So she'll take like some cheap dollar store plates and just throw plates at a tree and break them.
They have like smash rooms
Yes.
now.
Yes. So like smash rooms, that's the whole idea, right? Like you're just like, getting all of that cortisol release. Like doing
Yes.
something with it that helps to move that stress through your body in a positive way. So it's not frozen in your body.
Right. Yeah.
Yeah.
No, those are great ideas for people listening who have some stress. If you have woods around you, go into the woods and just let it out. Or can you scream into a pillow?
Yeah. No, why not? Right. Yeah. Scream into a pillow.
Maybe
Or
like
a
singing
closet.
in your car at the top of your
Yes.
lungs.
Yes. I think singing in your car at the top of your lungs, a little karaoke. Yes.
I would say like at least once every 3 months, I have a session like that where I will just go crazy with like Disney princess songs, like A Whole New World or
Yes.
that reflection song from Mulan. I don't know what
Yes.
about it.
It just really, it gets you. It gets you.
It gets me.
I love
It really
Mulan.
does.
Yep.
That's so funny.
For me, it's Pitch Perfect. I
Yes.
mean, it's so much good singing along in Pitch Perfect. Like if I'm having a day where I just need to like belt it out, like pulling up some
Yes.
Pitch Perfect. Yeah.
Yes. The other movie that did that for me, had that effect, was Eurovision with Will Ferrell.
I still haven't watched it. I've been meaning to watch
That
it.
movie is one of my top 5 favorite movies. It is so good in my opinion. Like the music is fantastic.
Okay, I'm gonna have to add it to my list.
Watch
It's
it this
on my
weekend.
list, but I'm gonna have to like move
Move
it
it
up.
to the top of your list.
I'm gonna move it. I love it.
Oh my God. All right. So to bring it all back
Yes, bring it all back. Bring it all back.
the Kegels, why
My
might people with
yeah.
IC be told to not do Kegels? And is a blanket statement of never do Kegels appropriate for people with IC?
Yeah. So I think what happens is in healthcare sometimes is that, if we see sort of a trend of something that, oh gosh, lots of folks with IC tend to have this increased tone, overactivity, like their muscles are staying too tight and tense, then there can be sort of this swing that is okay, then you should never contract your pelvic floor. Well, now potentially, kind of the same way that I hear you talking about, like, let's not create food fear. I think one of the things we want to be careful to do is I don't want to make you afraid to like contract your pelvic floor, like if you're going to cough or sneeze, or, oh, if I'm like, I have this urge and I'm trying to get to the bathroom, like, is it okay to squeeze my pelvic floor a little, right? So I think folks get told, don't do Kegels because they have all of this tone, which is an appropriate line of thought, 100%. So if you've had a therapist tell you don't do Kegels, they are totally appropriate. But now maybe it's coming to okay, can I use, these exercises in a way that actually could be helpful for me? And so I would say a blanket statement of, telling everyone with IC to never do Kegels. I think blanket statements in general tend to not be super helpful. What's interesting is the American Urologic Association, they actually put out in 2022, they updated their guidelines and said, people with IC shouldn't be given Kegels. But then when you go in and actually read the paper, they don't have any research to support that. And they even say, we don't have research that shows that Kegels negatively affect people. We just know that manual therapy helps them. And so I think that if I were just giving you like squeeze as hard as you can and do, 30 reps a day, like I would have no basis for that. So I think there's kind of this place in the middle of, can we use some gentle, squeeze, release, bear down? Is that something that, so you talked about, you find these times when your muscle is just squeezing and you're like, and then I can't seem to get it to release, right? So if we go to sort of a stuck drawer analogy, if you have a drawer that you're trying to pull out and it's stuck, sometimes if you push it back in, you can kind of get the thing unstuck and then you can pull it out. So one strategy that I'll have patients do when they say, when I find myself squeezing, I don't know how to let it go. I'll say, okay, here's what I want you to do is I want you to take a breath in. And then as you exhale, I want you to gently squeeze. So intentionally do a little gentle squeeze. And then as you inhale again, I want you to let it release, 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 release all the way. And then do just a little gentle bear down. So sometimes it's almost sort of this like, okay, if I squeeze it, then I can figure out how to release it. It's kind of like it turns something on in your brain that helps you to get that control back. Does that make sense?
Yeah.
Now, and that may not work for everybody at the beginning, right? So there may have to be some work done first on the tone. But for a lot of people, once you start getting that tone improved, they start to find that like, oh, I could do a gentle squeeze and a release. I can coordinate it with breathing, which now is going to turn on my, get my parasympathetic nervous system engaged. And so now maybe I can start to find that control of like, oh, okay, I can release my pelvic floor and get it to drop down into the chair that I'm sitting in, right? And now maybe I can figure out how to do that little gentle bear down and get that muscle to actually stretch a little bit.
Mm-hmm.
Yeah. Yeah.
That makes sense.
Yeah. Yeah.
So we know that seeing a pelvic floor physical therapist can be helpful for people with IC to really assess and determine the condition of their pelvic floor and create an individualized plan for them. So are there some ways that someone might try pelvic floor training or work on their own? Because I know some people just aren't able to afford it or don't have access.
But yeah. Yeah. Or they have a really long waiting list to get
Yes.
in.
Oh,
So,
yeah, we were just talking about that.
yes. Yeah. So what are some things that folks can do for themselves if they kind of want to figure this out themselves? So most definitely, if you can get in to see a pelvic therapist and have them do an assessment and get you started, definitely that is the most optimal and the most supreme. But, as you've identified and as, Janelle talked about on your podcast or two ago that, that there is really a shortage of pelvic PTs. And I think it is just because our profession is so new. I think it's also because people are starting to figure out that this is something they can do. So the demand is going up and we're not getting enough therapists out there to meet that demand. But if you're wanting to try some things on your own, what you can do is you can actually insert your own thumb or finger. So wash your hands first, of course. Insert your own thumb or finger, use a little lubricant if you need to, either, water-based, made for the vagina, or a silicone-based. Lots of great brands out there. But you can insert one thumb or finger into the vagina. The thumb tends to be the easiest. And then the first thing that you would do is, you don't want to hold your thumb or finger real stiffly, but you kind of want to let it soften a little bit, and then just kind of gently push into that muscle. So if I'm on the back wall of the vagina, I'm meant to have my pelvis model for all of this action. But if I put my thumb into the vagina, if I push along that back wall towards the rectum, and then just kind of feel, what does that muscle feel like to you? Does it feel nice and spongy? Does it feel really stiff, like that hard brownie? Or do you feel something that feels like a hard cord or a rope? So if it's really stiff and tight, then we can do some little gentle sort of contract, relax stretching to help with that. You can also press to the side walls too. So I can turn my thumb to the left. I can switch hands, turn to the right. So I can use my thumb to assess bottom, left, and right. The only direction you don't want to push straight up to the pubic bone, because that pushes on the urethra. That's not going to feel good. It's going to tell you real fast. You can work right next to the urethra, but you don't want to push straight on the urethra. So then what you can do is, as you insert that thumb, feel that tone. If it feels really stiff, then, maybe, and if it's really painful, then we want to do some really gentle squeezes. So keeping that thumb inserted, you'll take a breath in. And I always say, breathe as if you're smelling freshly baked cookies. That just really gets like that whole like chest and trunk. You get like a really good diaphragmatic breath when you do that. So breathe as if you're smelling freshly baked cookies. And then as you exhale, do a very gentle squeeze around that thumb or finger. Hold that through the exhale. As you inhale, let it release completely. So you would repeat that about 3 or 4 times in a row. Just that inhale, exhale, gentle squeeze. Inhale and release fully. So do that a couple of times. And then after the last repetition, kind of doing a little assessment in your head. Did each contraction, was it painful? Did it get more painful? If it got more painful and you feel like you're getting more tone, then this is not going to be the right thing for you, at least not at this point. You might need to do some other work on your muscle tone first. But if you found that by the 3rd, 4th repetition, like, oh, okay, that actually got a little less irritated, a little less stingy, then by that last one, you can now add just a little gentle stretch. So I do a little contract, relax a couple times with my breathing. And then after the last release, while my muscle's relaxed, I'm now going to add a little stretch to that muscle. And then you just hang out there for 5 slow breaths. So you could do this too with your wand, with your vaginal trainers or dilators. And so what this contract, relax does is it does a couple of things. So this gets into for the nerds in the audience who want like what's the physiology behind this? So what it does is when you contract your muscle, it turns on something called the Golgi tendon organ, or the GTO, that is in your muscle. So these little GTOs in the muscle, what their job is to do is to prevent a muscle from overworking or overstraining itself. So you get the spinal cord reflex that makes the muscle relax itself. So you turn on these little GTOs, that kind of forces the muscle to relax. So you can kind of think of this as like yoga for the pelvic floor muscle, right? So if you have somebody with a lot of pain, I wouldn't send them to go do CrossFit per se, but maybe I'd send them to do yoga. And maybe CrossFit's better down the road when they get, healthier. But right now we need yoga for the pelvic floor. So the other thing that it does is it turns on the motor cortex of the brain. And when we turn on the motor cortex in the brain that controls the pelvic floor, that actually inhibits pain pathways. So all of that pain that's produced by your brain for the bladder, it actually inhibits that. And then when we turn on the motor cortex, the other thing is it also helps to reduce fear of movement. And reducing fear of movement also helps to reduce pain. It's also going to release endogenous opioids. So you have your own little pharmacy in your brain that helps with pain relief. And then as we combine it with that breath, it just gets your parasympathetic nervous system going too. It also gives you something that you can do for yourself, where you're not just, because sometimes when you're using you've probably noticed this, that sometimes when you're using your wand and you're pushing on a muscle, it's almost like that muscle just sort of hits this plateau. Like, I can't get it to do anything else at this point. So sometimes those little gentle contractions and relaxations, it just helps that muscle to start kind of working with you to create its own release. Does that make sense?
Yeah. You
Yep.
just threw a lot of science at me, and I'm just
I'm sorry.
digesting it.
I'm so sorry. You're like, it's too early. I'm so
No,
sorry.
no, no. I'm sure it'll be great for a lot of the listeners. Don't even worry about it. I'm I'm just interested because I am a wand user and I've never really considered doing it like just with a finger.
Yeah, yeah. So one thing that I like about the finger, and this also brings me to some folks have sort of an aversion to touching their own vagina, and sometimes that can contribute to anxiety and pain with the pelvic floor and interstitial cystitis. If that's something that's going on for someone, I highly recommend going to see a counselor to address that, or getting someone to help them with that, because that can actually be a part of that pain cycle. But if you're cool with touching your vagina, or even if you're just like, okay, I'm a little wiggy about it, but I'm willing to give it a shot. One thing that I like is with you touching your own vagina, then that sensation of feeling the inside of your vagina and just being like, oh, there's lumps and bumps in there. That's interesting. Is that normal? And it's normal. I'm going to tell you it's normal. Whatever you feel is normal. Everything, it's supposed to be lumpy and bumpy, right? So just feeling your own vagina, starting to feel your own muscles and what they feel like, your brain starts to get familiar with that space. So if you think of, the vagina is kind of this like cave that we can't see. So it's kind of this like darkened room that your brain doesn't know what's going on. So now when your bladder is irritated, it's kind of like your brain heightens that message and you get heightened pain or heightened sensitivity, because your brain's like, we don't know what's going on down there and we need you to do something about it. So I say it's kind of like stepping into a dark room. So if I go into a dark room in my house and I hear something move, what's going to happen? My heart's going to race. I'm going to start breathing fast. I'm going to be like, or hold my breath, one of the two. I'm going to tense up. Like, what was that? Is there a burglar in the house? Like, what's going on? I flip on the light, right? So I flip on the light. Now I can see, and like, oh, okay, it's just the cat. The cat jumped off the counter. Right.
Those
Right. And now I
cats.
can calm down. Right. So now I can see what's in the room. So you can so we can't see what's in our vagina. We can see the vulva, right? So we can hold a mirror in front of our vulvar tissues and kind of see the outside. But to kind of air quotes, see the inside, if you insert a thumb or finger and start to kind of like, okay, this is what my muscles feel like. This is what that space feels like. Then it's kind of like your brain can start to map that out, and that space starts to be a little less scary to your brain. Does that make sense?
Yeah,
So it can
totally.
be a really, and I often encourage folks, do a combo of both. Like sometimes use your thumb, sometimes use your wand. It's, use whatever you need in that moment that day.
Mhm. Yeah, absolutely. Are there any other techniques that you like to use with the pelvic floor muscle training that you were talking about?
Yeah, so I love to do imagery. So imagery can be a great tool. And I don't know, have you done any imagery, Callie? Has anybody ever walked you through some imagery techniques? Pelvic floor
Maybe,
work?
but nothing that I can remember recently.
Yeah, 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 sure. Okay, so one of the techniques I like to do, so if I'm oftentimes I'll do this if I'm doing manual therapy with a patient. So this is how I'll introduce it to them. So let's say, I have my finger inserted vaginally and we have found kind of a tender spot. So I'll just kind of sit gently on that spot, and then I'll tell the patient. So I'll just kind of give a couple of examples, but I'll start with one that most people respond really well to. So I'll say, imagine at the tip of my finger, and you could do this to yourself. So you could insert your own thumb or finger, find a tender spot, and then imagine that there is a warm dot of color at the tip of my finger. So whatever color in your brain that you're like, that color is, I associate that with warmth and calm and relaxation. That's the color that I want you to imagine. So imagine that warm dot of color at the tip of my finger. And now with each breath that you take in, so that slow breath as if you're smelling some freshly baked cookies. With each breath, just imagining that warm dot slowly spreading through the muscle. And then just depending on what's going on with the patient, we could talk about, it's going to go, that muscle that's going to spread to your urethra. And then with the next breath, it spreads to your bladder. And the next breath, it spreads into your hip joint, your SI joint. So basically wherever that person needs it, anywhere from their foot to their head to maybe even outside of their body. I had a patient one time that was like, it feels like my pain is right here outside of my hip. I'm like, okay, warm dot of color goes outside of your body, wherever you need it. And people respond really well. That's one that a lot of folks respond really well to. So some other examples are, imagine that your pelvic floor muscles are made of taffy. And so imagine that it's taffy that's in the warm sun. So with each breath that you take in, that taffy just softens and elongates and expands, and it just gently opens up. So you can just sort of imagine those muscles just sort of gently elongating. I don't use the word stretch because most people think of the word stretch as like tight, like I'm making that muscle like long and tight. So I think more like elongate, expand, soften, where the muscle's kind of loosening up. Another one is imagining that your pelvic floor muscles are made of butter, and that butter is sitting on a warm plate. And with each breath in, that butter just slowly sort of softens and melts. Another example for folks who like the beach, if you don't like the beach and you don't like sand, this is not a good one for you.
If you don't like the beach, that is a red flag for me, but that's okay.
Okay. Me too, but hey, there are some folks who just, they don't like the beach.
Yeah.
But if you like the beach, you can imagine like being there in like July, August, when the water is actually a little warm, and imagine just kind of sitting in that surf water, just kind of right at the edge of the water. And so you're sitting, your buttocks are supported, your sit bones are supported by that warm, squishy sand. And then with each lap of the water over your legs, that occurs with each breath in. And then with each lap of the water, your buttocks are kind of sinking and supported, excuse me, into that warm sand, and your muscles can kind of soften and rest into that. And then what I encourage folks to do is, take about 2 minutes each day, because I'd rather you do it for a short time every single day than try to do it for like 10 minutes one day a week. But take 2 minutes a day. And if one of these resonates with you, just like lay on your bed or get in your recliner or lay on your couch, whatever, and just practice this imagery. And if you practice it every day, it's kind of like exercising this little muscle in your brain that you can tap into, that now when you're, Callie, in that space of like, I feel my pelvic floor muscles squeezing, if you've been practicing this imagery, then you can be like, okay, let me get my warm dot of color in my head. Okay, now my muscles can release. So the more you practice it, it becomes this thing that you can sort of quickly access. And as I tell patients, you may not always be able to use your wand, but you can always use your brain, right? So if I'm in the middle of a meeting, I can't be like, hold on, guys, I gotta get my wand out for a second, right? But you can sort of do this moment of like, okay, let me tap into my breathing. Let me tap into this imagery. Okay, I got my muscles to release. That's at least gonna tide me over until later when I can, soak in the warm tub or sit on my cold pack or use my fire crotch bomb. Did I say that right? Or
Yeah.
or do my wand. So then that kind of gives you something that you can use to get you to the next thing that you need to do.
Mm-hmm. Yeah. All those are great ideas.
Hey, yeah. And I started saying, I used to give a color. And then one day I kind of said to a patient, I was like, imagine like warm yellow sunshine at my fingertip. And she was like, well, a warm color for me is actually like pink sunset. I was like, oh, I've been trying to give people a color, and that's not necessarily, like you said, figure out
Yeah.
what works for you, right? So I realized the color that works for me doesn't work for other people. So I've heard things all over the rainbow, from green, blue, sunset, pinks, oranges, russet, lavender. I had a patient one time that was like, it's like a soft lavender. So it's whatever works for you. So I'm just curious, what was your warm color?
I've been thinking about that as you were talking, and it's hard to say, but I think my gut reaction goes to orange. I don't know why.
A lot of people say orange, like variations.
Yeah, maybe it's kind of that like sunset type
Sunset. Mhm.
orange. Yeah.
Yeah. Yeah.
Interesting.
Yeah.
Okay. Well, this has all been really helpful. Do you have any final take-home messages for the listeners?
Yeah. So, I would say that, what I'm definitely not saying is you should listen to this podcast and be like, oh, I'm going to start doing Kegels. That is definitely not the message that I'm trying to get out there for folks with IC. But knowing that some of these gentle exercises combined with breathing, that sometimes this can help you start getting control of those muscles again, can start reducing that tone, tap into some of that physiology to help reduce some of the pain. Just know that if you try some of these techniques, if it seems to make your symptoms worse, it's not the right thing for you. Either it's just not the right thing now because you need some other things first, or maybe it's never the right thing for you. So maybe that's never a good thing. Maybe for you, figuring out, using bearing down is a good thing for you. And so just kind of realizing that this could be something useful for you, and it's worth, giving it a try. You won't hurt anything by trying it, if that makes sense.
Totally.
Yeah. Yeah. But don't be afraid to use your pelvic muscles.
Okay. Yeah, I
Yeah.
think that's a really great takeaway from this. Is there anything else that we did not talk about that you wanted to get in there?
Not that I can think of. Not that I
I
can
feel
think
like we packed this episode with a lot of information. People may need to listen to it twice. If that's the case, I'm so sorry, but I'm not sorry at the same time.
I love it. I love it. I love your podcast, Callie. I love just your very balanced approach. I love how you really just, encourage folks to kind of figure out their path and their journey. And I think that's where, a lot of us healthcare providers, that work with patients who have pain or chronic pain conditions. I think, when you find the provider that says, let me do what we need to do for you, and maybe the thing that works for most people doesn't work for you, I think that's a good provider to be working with. So thank you for getting that message out to folks.
You are so welcome. And thank you for giving us an hour of your time this morning. This has been so helpful.
Oh my gosh, this has been so fun. Like I told you, I can talk all day. So this is
Oh,
this is
that's
easy
so
for me.
funny. Oh man. Well, okay, perfect.